What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
What's up, everybody? This is Dr. Zach Baker of Rehab to Perform and R2P Academy, and you are listening to the Strength and Knowledge Podcast right now, and we have got on with us a special guest, Ryan Foley, who I'm excited to have on here because him and his company will actually be out at our Gambrills location later this year doing a continuing education course for us. And this is a course that I saw come out I've been tracking it for a few years and have heard nothing but great things from people who have gone to it. Some of our more tenured and senior clinicians on our staff who admittedly have taken a lot of Con Ed courses, always speak highly of the course and integrate a lot of these principles just into our daily practice. So I personally have not gotten to attend one yet, so I'm looking forward to them getting out here and learning a thing or two myself. But Ryan, thanks for coming on, and do you mind just taking a minute to tell the listeners a little bit about who you are and what your background is?
Sure, yeah, thanks so much for having me, Zach. It's a pleasure. Yeah, so my name is Ryan. I'm a physical therapist. I'm originally from Ireland, so I practice out of Ireland at the moment in the county of Waterford, which is in the southeast of Ireland. But I went to school in Nazareth University in upstate New York in Rochester. So that's where I did my studies. And that's where I met Kyle Paxton, the other co-founder of our company, our educational company, Integrated Kinetic Neurology. It's a bit of a mouthful. Kind of looking back on it now, it's probably a bit too much of a mouthful to name a educational company, but look, we can't really change it now. But I do, as we'll get into the podcast, I think it does kind of represent, our thought process when it comes to rehab. But yeah, me and Kyle met in university. We came out of school together, and we both had the same kind of dissatisfaction with, not necessarily with what we learned in physical therapy school, because I think that gave us a good baseline, but we just were hungry for more and hungry for a bit more of a framework to guide our thought process when practicing physical therapy. And so that kind of drove us towards creating Integrated Kinetic Neurology, which is what we're bringing to Gambrills this September.
No, that's awesome. And I like how you alluded to, we learn a lot in PT school, but you learn a lot, which is really a little about everything. And you don't get to deep dive as much as you would like to into some of the biomechanical principles or some of the strength conditioning or program design aspect of things, or maybe it's motor development and neurological development. So Con Ed courses are great because you get to interact with people who allow you to go down those rabbit holes and take a deep dive into different areas of that, or teach you how all of that interacts together. And I think that was coming out of school. I've been practicing for 12 years now, and I feel like I hope I'm getting better at it, but I always say I've never really changed. I wouldn't say my success rate with patients has gotten better, meaning in the beginning, 50% got better, 50% got worse. I feel like my success rate now is very similar to when I came out of school, but I find myself wasting less time with patients. I'm able to filter through activities that may just be superfluous or may just not have a whole lot of ROI within the plan of care. And I find myself now, after taking different courses and just having experiential, kind of anecdotal evidence with patients, having a better idea of pattern recognition and just some different heuristics and models, that it's really streamlined care. And when people that I've interacted with who have taken your course, they said that that's one thing that they feel much more confident with, is being able to find kind of that entry point with an individual, and then identifying, all right, once they have that entry point, really knowing what's going to be the best domino to go after that's going to have a good sequence after that. Would you mind talking a little bit within your guys' course, for people who are interested in taking it or what it's about? Can you kind of frame up a macro of what a weekend would look like and what you guys cover?
Yeah, sure. Yeah, I like just to touch on what you said there, like with physical therapy school. I do think physical therapy school kind of gets a bad rap sometimes. People say like, oh, it didn't really prepare me for the real world, but I don't think it's supposed to. And I think that's where Con Ed courses come into play, because everyone has to reach a certain minimum after physical therapy school. So you still everyone has to get there together. Some people are further ahead. And I think those are typically the people that are hungry for more after physical therapy school. So I think kind of that's a good point that you touched on there. But yeah, generally I think with IKN, just to call it IKN for short, we realized very quickly that we're all in the business as physios, as strength coaches, any rehab practitioner. We're all in the business of applying physical stress to someone's system, for different reasons. That makes up a large majority of our approach, via exercise typically. Now, manual therapy you can consider through a stress application lens as well, versus exercise-based strategies is the physical application of stress. They're vehicles of stress application, but they're typically requiring the individual to exert some kind of active participation where they're generating some kind of internal force against external force. Whereas manual therapy is more of a passive delivery of force where you, the therapist, apply the external load. And so with that, and understanding that a lot of what we do is applying physical stress via exercise. Of course, there's education and other modalities as well. But I think what's important then to consider is the framework that guides how you apply that stress. The thought process that you use to guide the application of physical stress. And that's one thing that we put a huge amount of emphasis on with IKN is, what information do you use to guide that stress application? And that's why we put a lot of emphasis on the assessment portion, subjective and objective assessments to guide that initial thought process and to guide the shift into the objective assessments. And one thing with IKN is that we appreciate the uncertainty of the human movement system. And I think coming out of physical therapy school, you tend to think things are very certain in nature, where someone has X, Y, or Z limitation and we apply this technique to correct that limitation or that impairment, so to speak. But we soon learn that that's not the case at all. And you alluded to it there. It's about identifying the entry points to treatment. And when we're first going through the assessment, we have to consider that we're only meeting that individual that we're talking to, that we're assessing for the first time. So we can't really gather all the necessary information to know fully what's going on. We're operating essentially on incomplete information. So it's important to understand that we can only plan the first step, we can only plan the entry point, and then we adjust along the way. But we have to have a framework that guides that adjustment process. Like you do something, sometimes it's not always going to have the effect that you thought. And so you have to be ready to adjust and refine things. But you also have to know how you arrived at what you did in order to adjust. So if you're doing something just because you saw it on YouTube or you saw it on Instagram or you learned it in PT school, but you don't know how you arrived at that decision to do that thing, then it's very difficult to adjust. And so that's largely what we do at IKN is we have an assessment and rehab framework to guide how we apply stress to the movement system with the intention of influencing an individual's pain, their tolerance, or building capacities, physical capacities across the system. And this all comes back to, of course, the individual's goals, their pain experience, their concerns, their aggravating features, all those things. And we kind of use multiple components of the movement system to guide that. And we call these kind of neuromechanical features where we try to appreciate how the nervous system is interacting with the anatomy, how the anatomy is designed, why universally we all have this, overarching design architecture where we have a segmented spine and we have a non-segmented femur, tibia, fibula, humerus, radius, ulna. So we try to dive into the architectural design of the anatomy to guide that process and integrate that with the unique individual to try and establish, appropriate entry points and then use a framework to guide how we refine and adjust our stress application.
That's awesome. And you had mentioned earlier about how really the PT, rehab, reconditioning world, it's all about dosaging of stresses, and whether that's physical stress or psychological or perceived stress. And a lot of that really comes down to we overcomplicate things almost too much in our mind when we really just need to figure out how much positional demands do we need to give somebody and how much exertional demands do we need to give somebody. And then based off that great subjective and objective assessment you do, you can then filter out if they're struggling to obtain this position or they're struggling to meet the demands of a task, what is that rate limiting factor? Is it mobility related? Is it strength related? Is it motor control or maybe just the novelty of the movement? And a lot of that comes down to, like you had alluded to earlier, the foundational things that we learn in PT school and having a really good understanding of kind of what that first step is, but then having some sort of repeatable process at play to implement an intervention, see how they are modifying, adapting, and progressing with that intervention, and if it's actually achieving the desired outcome that we intended it to. If not, we go back, we reverse engineer another step, and we create another plan. We try it again, we check, and we adjust. And it's that, that PDCA loop of plan, do, check, and adjust. And it's this constant process. But like you alluded to, if we don't have a systematic and repeatable approach to it, there's too much variability, and we can't account for all the variability within the system. And that standard deviation of what used to be an acceptable level of uncertainty becomes an uncontrollable level of uncertainty. And when we start chasing our tail almost. I love the teaching aspect of continuing education. And that's part of my role at R2P. I do half of my workload is patient care. Another quarter of it is running our sports residency, where I lecture and teach and mentor within that. And being in the academic side from a residency component, that has opened my eyes to some of the struggles of creating a curriculum, changing a curriculum, and some of the things that the PT schools go through. And I can't imagine doing it on the scale that they operate. And then the other component is internal and external education. And we do continuing education courses ourselves. I've had the ability to teach in front of a variety of audiences. And I feel like every time I teach a course, even though it's the one that we've created, I learn something either about the delivery of the material or refining the material to the audience that you have. Has there been any realizations that you've had as an instructor as you've gone and you've created the course and you've delivered it? What has either been the biggest surprise to you as a teacher and an instructor, or just something that you found yourself continually refining and trying to adapt either to the audience or in preparation for an upcoming course?
Yeah, that's a good question. And I do experience the same things. Every course, when I'm finished day one or day two, I'm rushing home and I'm writing down things that I can change and update, just based on feedback and based on the interactions during the course. So it's a fun experience. But definitely, I think just to kind of go back to, coming out of PT school and going through lots of Con Ed courses, I just had the ability, I suppose you can say, to simplify things in my mind. And every educational course, whether it be a manual therapy course or an exercise therapy course, it all came back to stress application. And with exercise, it's obviously, physical stress application. And every extra Con Ed course around exercise was just a company that had their own framework to guide stress application. And so we made not necessarily a mistake, but we tried to make things too complex early on, tried to get too neurologically driven to make things a little bit different. Whereas we quickly found out that, trying to be guided only by the nervous system, when you are working with more musculoskeletal conditions, people with, post-surgical or, with a current experience of pain, musculoskeletal pain, using the nervous system as that entry point is not a very good guiding point. It's not a very good start. So we need to look from the bottom up first, we found. And so that's where we always wanted to integrate more of a biomechanical lens while still appreciating, non-physical stressors, an individual's confidence, their beliefs about certain things. But that really is what we have adapted along the way, is to make things a bit more clear cut. Try to utilize biomechanics as that initial entry point. And biomechanics does get a bad rap in the pain world, at least. But that's only when you're only using a biomechanical lens. And when you don't understand how biomechanics is guiding, because biomechanics is essentially just something, it's one thing of many things that guides or informs you as to how to apply that physical stress to the system, because we are physical creatures that operate in in a physical world. So we have to interact with forces. And so we've adapted to meet that kind of criteria along the way to try and make things simple. Use the movement system, use muscles and joints. That's one thing as well that we've changed along the way. We've tried to, integrate too many components of the movement system to guide that initial thought process. And like you said early on, when you're trying to be informed by too much early on, things get messy. There's too much variability and you don't know where to go with your treatment. And so simplifying things early on, and we've eventually arrived at looking at just muscles and joints. How are the muscles and joints behaving as you apply stress to the system? What is the current behavior of the individual's muscle and joints? What are the demands that you alluded to? What are the goal task demands? What do they have to get back to? And how might the muscles and joints need to operate in order to meet those demands? And then we can use that to guide our assessment and to guide our initial treatment. So I think it's been overall a process of just simplifying things along the way based on feedback and based on how we're experiencing individuals utilize the information that we teach within their clinical settings, within their own approaches. And so I think that's been the fascinating part of it, is that we haven't really gotten more complex, is that we've made things simple, but it gives us a nice broader foundation upon which to go deeper if necessary.
And I love that, because I actually think complexity will find you if you seek it out. And when you go into these courses, you almost need to go into them, especially when you don't know what your audience is. If you have a closed course where you're doing it for a specific organization or a company, and they can kind of tell you what they are hoping you are trying to bring to them, or they can give you an idea of their level of experience or seniority within the room, then you can cater the talk a little bit. But especially when you're going into an open classroom with such wide variety of, you may have strength and conditioning professionals, you may have physical therapists, you may have chiropractors, you may have physicians or people from the medical side. Biomechanics does tend to be the one common language that we all know, or at least that we may be the most comfortable kind of expressing in a group environment. And I think you need to speak to whatever that baseline commonality is within the group. And if you can get everybody on the same foot there, then you start to, you breed a level of comfort with conversation. The course becomes more interactive. It becomes more dialogue driven. And a lot of times those more complex questions, they come from that dialogue. And this is something that I actually found. I created an online course, and it was extremely challenging for me to create, because I didn't realize how much of our in-person course is dependent on that back and forth dialogue of answering the "it depends" question. And when I was creating this ACL rehab course, I had such a hard time committing to what I wanted to put on paper as the framework for ACL rehab, because every time I would write something down in my head, I was thinking, well, gosh, I mean, this works, but it could also go this way if they present in this manner, if the test doesn't go, or you notice this. So that was, I think I spent more time in the opening welcome video of my online course, just constantly reiterating, this is an example of a progression that can be utilized. And there's a variety of different ways that you can lateralize or accelerate or decelerate the progression based off your individual condition, your system, your patient, their symptom profile, and their movement demands. But I do find that some of the best courses that we have had is when we went in with a very basic approach with the explanation of a given slide. That may be a very busy slide or a very complex one, and we try to provide a very basic, concise presentation of that slide, and then somebody asks for additional clarity, or they ask a really good question. And then before you know it, you're 5, 10, 15 minutes into going in depth on what the whole purpose of the slide was. And I think part of that also comes down to your own comfort level as an instructor of being able to elaborate when needed and being able to read the room of, are we going over the heads of too many people, or are we boring too many and we're underwhelming people in this room? And I don't know if you've ever had that experience, but I've gotten to lunchtime at day one a few times. You ask a question, you get an answer and realize, I don't think we're on the same page. We may need to slow down and backtrack a little bit. And then I've also gotten to lunchtime on day one with a couple court classes and realized they are eating this up, and we can accelerate some of these more simple points and really get into the weeds with, you talk about movement, and, do we really dive into the weeds of all of the different kinetic principles that can guide movement? And are we stuck talking about force, or are we really getting into force versus impulse versus momentum and versus all of these kind of minute details of what the expression of force actually looks like? With you guys travel extensively for the course. How many different areas have you, either have you or just the company in general, been in to teach this course?
Yeah, we've been in every continent so far, I believe. We teach before COVID, we taught a lot in the US. Post-COVID now, a lot of our kind of US therapists will kind of learn online. We'd love to get back into teaching a lot more courses in the US, but mainly now a lot of our in-person courses are across Europe and Asia. So last year was probably the biggest year of travel post-COVID, where I think on back-to-back weekends, I was in Singapore, Hong Kong, South Korea, and then Dubai. And so I was gone. I was out of clinic for quite a while there. And then we've got a couple of courses coming up in Europe, in Slovakia, and in Latvia in the next 2 months as well. So a lot of in-person courses in Europe and Asia. We'd love to, and we're looking forward to obviously coming back to the US now this year to teach. But yeah, it's busy, but I like it. I like having the change of scenery and just the change of pace from clinic, because I work in clinic when I'm not teaching. I'm working in my own clinic here in Ireland. So having both gives you a lot of flexibility, but it also gives you a lot more information that you can use to kind of navigate those, as you were alluding to. I think navigating what ifs is an important point to discuss. Like you said, you do something, maybe it didn't have the effect you anticipated. So what do you do now? Those open up those interesting dialogues. And I think you gather those from your own patient interactions as well. And then I'm after a patient interaction and after the session, I'm writing things down and I'm using that to then further guide how we kind of teach IKN. And it has definitely helped over the years.
When Josh Funk, the owner of Rehab to Perform, had first introduced me to Kyle and just the IKN group, I had known that you guys had a reputation, and I had known that you guys were very well received in our area. I had no clue how expansive your network was from a teaching standpoint. And I think that really just goes to resonate, where it is tough to create a course, and it's tough to run a business that is appealing to a wide variety of people. And it's easy to create a niche and get hyper-focused in one area. It is tough to speak a message that resonates worldwide and is received that well. So, congratulations to you guys for being able to do that and being able to do it for as long as you have. I'm curious, as you have traveled around and you've gotten to be in all these different countries and continents and area of the world, is there any, I would guess, like distinct either commonalities that you see that do resonate within the physical therapy profession worldwide? Because admittedly, I'm a little bit naive in regards to how different the education may be in regards to either the level or the duration of education to become a physical therapist in the U.S. versus Japan versus Ireland. Is there anything that you do find is just a very consistent commonality? And then I guess maybe the more appropriate question would be, are there any striking differences that you've noticed in regards to how different areas of the world approach physical therapy? And I'm sure some of that may be guided by scope of practice and just, cultural differences with what the expectations are.
Yeah, that's a good question. We do get a nice mix of practitioners on our courses. Everywhere, really, we get a lot of strength coaches, trainers and physios, occupational therapists even as well, athletic trainers. And so I think what I found is in some countries, in Asia especially, and I'm not trying to paint them all with the same brush, but there is a lot more focus on manually driven treatment approaches. Okay. And so I have found that, even just learning the basic biomechanical features that guide how we um, perform exercise, how we understand what exercise might be appropriate for a certain individual, is just not there in certain countries. And so we do certainly have to simplify day one on within those courses, which makes it a little bit tougher. But I do think it stands to the individuals. I do think it provides them with a better foundation to kind of build upon in their own practice. Because I do think, like you said there too, it's difficult to, especially in the last year or so, it's difficult to continue to send the message you want to send, especially with social media. And we're all constantly being given these quick fixes. We're all in quick fixes for everything. Low back pain, shoulder pain, and we're constantly kind of having to fight against these quick fixes. And so trying to maintain the message of, having a solid framework to guide your rehabilitation approach, to guide your assessment, really stand at the forefront for us. And we really tried to continue pushing that. And it's a bit more challenging to get that across in Asia, we found, because there is that focus on, being a bit more certain with our treatment strategies. And I do think a lot of the practitioners we've had in Asia and not necessarily across Europe, they've been more new grad therapists. And so they're coming into the real world wanting that certainty, a framework that, allows you to predict, or they want that framework to help them predict what's going to happen and to predict the future, essentially, which, as we know, like once you're in the field for long enough, you realize that there's no framework that's going to offer you that certainty, but you have to have a process that allows you to navigate the uncertainty. And so getting that across to a lot of new grad physios has been the most challenging thing. The US definitely has been up there with some of the best practitioners we've taught, because I do think they appreciate the uncertainty a lot more than others. Again, I think it's a case where you can certainly appreciate the uncertainty, but I think there's a difference between appreciating that things are uncertain and then doing something different than actually being guided by uncertainty. So I think there's a difference in how you navigate that approach. You can be guided by uncertainty and use a process, kind of feedback loop driven approach, but you can still appreciate uncertainty, but do things that you think your clients want to hear. You want to give them quick fixes. You want to do things that they want. But I think, if you are to appreciate the uncertainty of things, you have to have a clear process and plan of action that navigates that and appreciates that. So that's the biggest thing that we found, the difference between the US and Asia, especially on our online courses where we've had the chance to have that back and forth interaction over a longer period of time with US practitioners.
No, that's great. And I think going on the topic of uncertainty, and you alluded to this, there's a difference between appreciating uncertain. And the way that I look at that is knowing that regardless how many constraints you can provide, and regardless of how many parameters you can set, there's still going to be a degree that you have no control over. No matter how much you try, there's just a degree that you have no control over. But that doesn't mean that you're not monitoring it, and it doesn't mean that you're not factoring that in to the rest of the stuff that you do have certainty over. And I think the people who are most comfortable with uncertainty are the ones that have a very firm grasp on the stuff that we can have a firm grasp on, meaning they know their anatomy front and back. They know their pathophysiology very, very well. They know all of the different systems, whether it's the anatomy, the biology, or the physiology associated with it. They have such a good understanding of that they appreciate the stuff that they do not know all that well truly is uncertainty and not just a lack of knowledge or a very superficial base of knowledge on that. And I think part of that does come with experience, and it does come with just acquiring more knowledge, which is why I do think there's not a direct cause and effect, but there is typically a correlation between comfort with uncertainty and years in practice. And obviously you're going to have some people that they're your outliers who are just very intelligent and very good at what they do, and they hit the ground running right after graduation. But most of us are going to fall into that pattern of you come out of school and there's a lot that you just don't know, and you may understand what the expectation is from a textbook of how somebody will present and how they'll respond to an intervention, but you have a sample size of n equals 0, n equals 1. So you haven't gotten to put any of that theory into practical use. And that was really where my guessing game was coming out of school was, hey, I know that this, say this stretch is supposed to help with this movement impairment. What I didn't know was, is it immediate? And is it going to show itself within 10 to 15 seconds, or is it going to need time to take place and maybe 1, 2, or 3 sessions or a few weeks? And I think until you have seen that intervention play out with a variety of people who fit similar demographics and similar pathologies, that's when you can start to get that window of what the expectation is.
Yeah, and then what do you do when it doesn't work?
Yes.
Is the question, I think, is the process that I think scares a lot of people, but it shouldn't. And I think having those conversations about what if it doesn't work, what do you do then? That's where the decision-making process or the decision-making framework that guides your process is crucial.
Absolutely. And I think a lot of that comes down to, like you allude to in your course, is you are going through the assessment process and you're almost triaging what are our high priorities that we want to address first, and then what are the other things that they may be influencing the situation. We just don't think they're the primary driver. And it allows you a very good framework to prioritize which sequence of events you're going to go after, what's our entry point. And if it doesn't give us our intended outcome, the first thing that I always do is I look at my delivery. And one, did I explain it well? Did I put the person in position for success? And maybe I did identify the problem and I did have the correct solution for that problem. I just didn't put it together all that well for the patient. Maybe I need to, change the environment, change my delivery, and see if that works. And if I do that and it still doesn't work, well, maybe my assessment wasn't that great. I need to go back and reassess and see where we're at with that. Ryan, you had also mentioned kind of one last question before we wrap things up, but did you mention that you also run your own clinic?
Yeah, so I have my own clinic here in Waterford, in Ireland, where I teach. I don't teach, but I treat a kind of a range of musculoskeletal conditions, between chronic pain and sports injuries. And so I'm in there 5 days a week if I'm not teaching. But if I am, I'm out of the clinic. I'm on my own in there, so I'm kind of a one-man show in clinic. But I really enjoy it.
That's how long have you been doing that practice on your own?
So I moved back from the US after working in New York for a couple of years in 2017, I think it was actually 2017. So I've been there for about 7-8 years now in Ireland operating. So a very big change of pace from New York and the way physical therapy is delivered over there.
Yes. And there's it's funny, we have students from all over the country. We have, I think, 125 different PT schools that we get students from, and everybody has their own view of what is ideal as an entrepreneur or as a clinic owner or business owner. And I'll just say the one thing, whether you have a single location that you're operating by yourself or you have multiple locations with multiple employees, there are pros and cons, and there are benefits and hidden struggles that only the business owner themselves is aware of. And I'm appreciative to have Josh on our end here at R2P, who handles a lot of that stuff behind the scenes that people do not need to deal with on a day-to-day basis. And I applaud people who are going through that process on their own. There's a lot of great flexibility and autonomy that you have, but there's also a lot of responsibility that you cannot hide from either when you're running your own practice as well. So that's it sounds like you've got a pretty awesome setup right now between what you have going on with IKN and what you have going on with your own practice. And we're going to be fortunate enough to have you out in the fall, September 14th and 15th at our Gambrills location, which for those who are unfamiliar, that is about 20 to 25 minutes southwest of Baltimore. So kind of in that greater Baltimore area, close to BWI Airport for anybody who's flying in from out of town. For anybody who is interested in either learning more about the course or registering for that course, Ryan, what is the best way for them to either get in touch with you or to get into that course?
Yeah, so the registration link is live on our website now at www.ikneurology.com. And they can reach out to us directly on Instagram as well if they want to access more information about what the course entails, what the 2 days will cover. But yeah, that's the best place to reach out to us is Instagram, or you can email us directly through our website. But the registration link is live on the website currently, so sign up whenever you can.
Awesome. Well, Ryan, I appreciate you taking the time out of your very busy schedule to come on here, and look forward to meeting you in the fall.
Absolutely. Thanks so much for having me.
Thanks.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.